Q&A at the end of the session, and we can take any more sensitive questions at that stage. Could I just ask everyone to mute their mics? I think I can hear a live one. Thank you in advance. To describe what we're going to be up to today, the reason we're all here is so that we can have a chance to update you on LOTI's plans for new service models in adult social care, at least an innovation day and fun to explore the possibility of doing that. We're also looking to explain our thinking, just so you get a sense of where LOTI's coming from and you can appreciate our rationale for taking the approach that we've done. And most importantly, we want to get your feedback as professionals who work in or around the adult social care sector to see what you make of what we've got planned, and very much welcome your steer on how we can make this as effective and as impactful as possible. Briefly, I think lots of you we have already met, we've had early conversations with. Some of you may be slightly new to LOTI, so we are the London Office of Technology and Innovation. Essentially, we're London local government's digital innovation community, and it's our task to work with London boroughs to help them collaborate, getting the best out of digital and data innovation to improve what they do, to improve services and to improve outcomes for Londoners. One common misconception is that whenever we mention this word digital, people think we're talking about laptops and networks and just talking about the computing side of things. That is not the case. When we talk about digital, we use a definition that was presented by a guy called Tom Loosemore, who was one of the founders of the Government Digital Service. And you'll see it on the left here. It's not just about tech. In fact, tech comes last. It's about applying the culture, processes, business models, and the technologies of the internet era to respond to people's raised expectations. In essence, what is it possible to do thanks to the fact that we live in this rather extraordinary time, the internet era? Tech is a part, but it's certainly not the driving piece behind it, what we do. For those of you who come from boroughs, just if you want to check, are you part of the LOTI community yet? Those highlighted in pink are the boroughs that we work with very closely. These are the boroughs who've shaped our work in all areas, including this one. However, because LOTI boroughs want to do this, if you come from other boroughs who aren't yet part of our membership, you are absolutely welcome here today. You're absolutely welcome to take part in what we describe today. Final bit of context is that LOTI works across lots of different areas. You'll see right in the start though, right in the centre though, our philosophy is we try and help bring the best of technology and data and digital innovation to really achieve outcomes and in areas that matter to Londoners. This year we've got 3 areas of thematic focus. You'll see at the bottom there, net zero, digital inclusion, and of course social care. It's based on lots of conversations we've had with our members, with chief execs, with frontline workers and everyone in between. Social care being a key area where innovation may have a powerful role to play, and it fits in with some of the methods that we feel we can offer. We are not experts on adult social care, neither are we experts on net zero or digital inclusion, but we have a set of methods, we have a community, we have some links and ability to convene people, to bring the experts together, such as yourselves, to have what we hope will be a really powerful conversation. In a moment, I'm just going to hand over to my colleague Genta to tell you more specifically about what we're planning in this area. Do though, throughout our conversation, post your comments or questions in the chat. At the end of our presentations, we will have a Q&A session, so you can air your views and thoughts at the end. But yeah, please use the chat throughout. For now though, I will hand over to Genta.
Thanks, Eddie. Hi everyone. As Eddie mentioned, the very first thing we are planning in this field is to hold an innovation day. So on the 21st of November, on Monday, we'll be hosting what we hope is a high energy innovation day for social care professionals like yourselves to come together with their third parties and third and private sector partners. And we're really hoping that this event will create the space and the opportunity for social care professionals to step out of that day-to-day role, to be inspired by examples of how innovation is helping to tackle other similar wicked problems, and also to have that chance to think creatively with like-minded colleagues. One other thing is about our event, I think it's also a chance to put aside the financial worries and considerations, and instead, as you can see on the slide, to be supported to think about radical new approaches to meeting adult social care needs in a way that could deliver better outcomes in a more sustainable way over the long term. In terms of the objectives for the day, we have three main objectives. The very first one is about bringing, like I mentioned before, to bring you all together to think creatively about approaches and new service models to help improve outcomes. One key objective is also to raise awareness and for us all to have a common understanding of what we mean by new service models. And then lastly, but equally importantly, we want to give you that opportunity to develop ideas and to explore the thinking of the art of the possible with your other colleagues. And we are hoping that that could lead to very specific project ideas that can then be submitted to a LOTI Innovation Fund. On the subject of the fund, at LOTI, if you don't already know, we have a bias towards action. So it's really great to come together one day to explore and think and ideate together. But it's even better if we can turn those ideas into tangible outputs that we can all benefit from. So to make that happen, we'll offer 200K. It's a modest pot, but we hope it will be enough to start some tangible things onto different projects, and we'll tell you more about this in a moment. But for now, I think I will hand over to Eddie.
Thank you, Gente. And so we mentioned our second objective was just sharing with you the way that we are thinking about this topic. And at the end, really keen to get your feedback on whether you think we're completely mad or whether there's a coalition of the willing who's on board with thinking in this way. So the first thing to say is we've had lots of conversations over the last few weeks and months with social care professionals in the public sector, third sector, private sector, and it's been abundantly apparent through all those conversations the sheer pressure on the system on so many of you financially, in terms of demand, and in terms of not feeling entirely satisfied with the outcomes we're able to deliver for some of our most vulnerable residents. Given that the state of the problems, which you will know in acute detail, I'll confess, Gente and I have been quite frustrated where elsewhere in local government, we hear digital colleagues spending hours and hours and hours talking about, well, there's a better bit of software we could put in here, or maybe we need more iPads for these sets of workers. And candidly, for us, this feels like we're missing the point. Bluntly, no amount of software, no amount of special hardware is going to solve the issues that we see given their state in an area like social care. And so this is what we believe. There's been amazing innovation in tech, but we've got to match it with equal innovation in the structures, processes and models that we apply it to. If we can be really imaginative there, then maybe we can make a real dent in improving outcomes in those ways. So given that, we can get sucked into a very hypothetical conversation, but I'd like to share with you just a few examples of organisations that have really inspired us and that I think demonstrate how social problems can be tackled in quite radically different ways. And to be absolutely clear, I am not saying, and LOTI is not saying, we can just copy and paste these models and that magically cures things. What we hope they do is help us think about our problems a bit differently. And I hope maybe prompt a conversation where we can think even more creatively about what might be possible. So let me share a few with them, and at the end I'll pick out what I think is so interesting about them and what they've got in common. The first one, I'm delighted to see a colleague, Rachel, who will be at our event on the 21st and supporting this, is Buurtzorg, that started in the Netherlands, a remarkable model that many of you will be familiar with, which replaces a model that we see in many countries around the world where community nurses are sort of timetabled very specifically, are having to have quite transactional interactions with the people they care for, with large back office staff. Instead, having self-managing teams of around 12 who look after their own recruitment, they make their own decisions on who they support for how long and in which ways. And if they need to spend a whole morning with one person to really resolve their problem, they can do that. They've got the freedom to do that. This is enabled by a very small back office staff and enabled by their own sort of social network that enables those self-organizing distributed teams to support each other. So there's a role for digital, but it's the model itself that is so radically different. The outcomes, patient satisfaction, are some of the highest you will see anywhere. And I think if I can quote one pilot that took place in the UK for this, some of the social workers involved saying, I rediscovered my vocation by working in this way. So really powerful testimony. And I'm very delighted that Björtsorg will be at the event itself to share some of the lessons learned and their experiences with all of us. The second one in a different field is the app Good Sam. If you're not familiar with this, if someone were to have a heart attack, you'd call an ambulance and the ambulance dispatcher obviously sends an ambulance to get to that person quickly, but it will also send out an alert via the Good Sam app that will alert trained first aiders in the vicinity of the victim, showing where the nearest defibrillator is, where the victim is, and if the volunteer can get there first, they might just save a life, and indeed they have saved lives. The point I want to make about this in the context of what digital innovation is, this is not an app that digitized calling 999. It's an app that has increased the capacity of part of the public sector in order to respond to a problem. What else could we do with that sort of concept? There's organisations who involve government playing the role of matchmaker rather than doing the thing or delivering the service or commissioning the service, realizing that their job is to say, well, here are some people with a need and here are some people who can respond to that need. And there's lots of different platforms out there and lots of different contexts that connect people on two sides of that sort of marketplace who need to be match made. One example that we think is really compelling is the Equal Care Co-op that does that very effectively, but also uses a cooperative business model. And having that co-op model keeps more money within the organisation, means that the carers can be paid more as well and have more of an incentive and ability to shape what the organisation does. Last two examples, which don't come from the care world, but I wonder if you've heard of Beam, which works in the homelessness space. And what I find so compelling about Beam is that they find someone who's at risk of becoming street homeless. They will say, well, what do you want to be? What training do you need to get to that position? Do you need a laptop? Do you need a smartphone? Shall we pay your first month's rent? Do you need childcare so you can attend the training? They do that deeply personalised preventative approach, and their results are extraordinary. About 82% of everyone that they have interacted with has gone on to now be in full-time employment with an average starting salary of £28,000. Compared to some areas that I've been involved in supporting the public sector homelessness response, which sometimes feels like we're just perpetuating people's need. You know, we've got a better temporary accommodation hostel or more food bank vouchers. This model is bouncing people out of the system so that they can go on and thrive and not be dependent on anyone's help to do that. A really, really powerful example that's now scaling very, very rapidly, both in the UK and now globally. Last example, again, may feel totally different, but of all places, Transport for London. 10 years ago, Transport for London made a really interesting decision that they would not create their own transport apps for consumers. Instead, they'd release the data on where all of their modes of transport are. And as a result, you've seen the creation of at least 600 apps, the most famous of which is City Mapper, used by lots and lots of people if you live and work in London. Other more niche ones for, say, people with accessibility needs that literally take data on where the lifts are and whether they're working or not so that they can plan their route. Again, government as data provider is a really interesting role that's provoked lots of different interesting citizen benefiting applications. Okay, these are the examples. What on earth, where are we going with this? What can we derive from this? What makes them interesting? Well, I'd argue that from everything we've heard in the area of social care, I wonder if you'd agree that we need every single tool in our tool set to respond to the scale of the challenge. And it's interesting to reflect, if we just look at our traditional model of public services, if you're here today from a local authority or from NHS, also part of the public sector, if you look on the headings I've got here, there's probably about 18 things you can change about your service to improve it, to optimize it, to make it better. You can change the amount of time, money, staff or assets you put towards a problem, You can change your structures, your processes, you can change the incentives, sometimes the scope of the service. You can raise awareness through publicity or deliberately dial it down. You can change the business model. And of course, you can look at things like technology and data and their role. Phenomenally powerful. There's a ton you can do with that. But what the examples I've just shared with you do, I think they're playing with an additional set of factors that have a huge role to play for those of us who want to think more radically. They change who's involved. Look at that Good Sam model where volunteers were able to work alongside emergency response to make change happen and to augment the power of that public service. They change the relationship. Think of those self-organizing teams in the Biertzorg model, which is a very distributed relationship rather than a top-down one. They change the organisation type. So think about the equal care co-op using a cooperative model to retain more money within the system. The funding method, think of Beam doing crowdfunding from individual donors as well as from government. Think of how they're changing power. Again, the Biertzorg model radically empowering the front line, the equal care co-op radically empowering the person being cared for. And all of them involve the public sector playing a different role. They're not just delivering a service or commissioning it, they're incentivizing it. They're providing the data for it. They're matchmaking within it. And these things feel like they might have some promise within the area of adult social care. Maybe we could change who's involved to increase the number of people, the capacity we've got to respond. Maybe we could change those relationships, the model that it sits within to avoid, do we have areas with large management overheads? Do we want to provide more localized solutions? Maybe there's a nugget of a thought there. Maybe we could change the organization type. Maybe we could bring in more funding. Maybe we could really empower some of our frontline workers in a different way, which might enable them to operate in more effectively. Again, these are all questions to pose, and maybe we could think really creatively about the public sector role. So those are some early thoughts. This is why we're interested in hosting quite an ambitious conversation. All the day-to-day and changes need to be made. We know there's legislative change. We know there's next year's financial pressure. All of that is vitally, vitally important. What we'd like to do is to create one day for a safe space to think really boldly and creatively about the long term. And on that note, let me hand back again to just to emphasise some more details about the design of what that day and fund will involve.
Thanks, Eddie. Just building on what Eddie mentioned about this being the start of the conversation and having that opportunity of creating that safe space for colleagues to think differently about these things, but also to find each other, to identify who is willing to kind of to work with us, but work with each other as well in this kind of new way, given all the different factors and the elements that we could adopt or implement in some way in our day-to-day work. So on the right-hand side of the screen, you'll see just some of the kind of mini objectives or benefits that we are hoping for the event. So we hope that this will be a chance for yourselves to meet, share and learn from like-minded colleagues who work either in the public, third or private sector, but with that ultimate aim of improving social care outcomes. We'll have an exhibition of some organizations that are adopting these new different ways of thinking. Eddie mentioned a few. There'll be a couple more. You'll have the chance to speak to them and connect with them directly. You'll also have a chance to learn more about how we are thinking about new service models and what that means for the public sector. Obviously, there's the opportunity for you to work with each other to develop and share your ideas for how things could be done differently. You're the experts. We want to invite you to do that with each other. And then lastly, and probably equally importantly, you'll learn more about our innovation fund, how you can apply, timelines, etc. That's it for me. And then so as I mentioned before, we'll have a 200k pot. We think we can fund 2 pilots. Again, it's a modest pot, but we'll be mindful. And the criteria on the left is the types of things that we will be thinking about when selecting projects. in addition to the financial side of things, so at LOTI we have access to methods, project management, capacity, the methodology, but also facilitators, people who can help you with things like bid writing or develop your ideas in greater detail. And again, we'll share more details on the day, but just something for you to bear in mind, that there are other things that we are offering in addition to the money. Again, you can see the criteria on the left-hand side of the screen, but maybe to mention a couple that are really important. We think focusing on prevention, everyone's mentioned this. We think that's perhaps a good one to start with. Particularly, we want to think about, as Eddie mentioned, all the different factors and the different role that government plays. We want to think about those models that empower residents themselves, the community and frontline practitioners more specifically. But then I probably will stop there, because you can read the things on the screen.
Thank you, Gente. And yeah, we'll invite your questions on this in just a moment. But first of all, just to wrap things up, very keen to hear from our local government sponsor, Emma McGowan, who's based at Hackney. Emma, over to you.
Thanks, Eddie. Hi, everyone. Nice to be here. Nice to see you all. So Eddie's asked me to give a bit of a perspective from working in local government, trying to kind of do innovation and change in social care. For those of you that don't know me, I'm head of transformation at Hackney. I've also worked at Camden, and before working at Camden, I worked at the digital design agency FutureGov. And I've spent the best part of the last decade working in the public sector in transformation and change, and mainly in social care services. Working on everything from how to transform front door services, on referral processes, through to creating better day services for adults with disabilities whilst trying to close physical buildings, through to the creation of new digital tools that support statutory services, essentially the evolution of what case management systems might become in the future. I also have quite a lot of personal experience of adult social care. My mum was a principal social worker, social care worker, and pretty much spent my entire childhood dominated by going to visit care homes and being surrounded by people with disabilities. And I've also had the experience of trying to get care for my father, who had a quite extreme form of vascular dementia and psychosis, and required quite a lot of negotiating with the NHS and our local authority to try and get funding. So from both sides, I can really understand the crisis that we're in at the moment. And I think my main takeaways over the last decade is it's just incredibly frustrating that we all seem to have these challenges, and we all seem to approach them in a slightly different way. And I'm not disputing that we have a local agenda, and each neighbourhood and each borough is slightly different, but there's a lot of time and energy that's spent on reinventing the wheel, and overall that costs the sector just far too much money and time. Like, we are delivery agents, we have got to deliver and run services, and we're spending a lot of time thinking all independently about how we should do this. And we might be able to say that's a failing in central government, but like, that's where we are at the moment. And I really, really want us to stop doing that. As a consultant, I think the most frustrating thing for me was to go from borough to borough and redesign the same service in different local authorities. And of course, we take our learnings with us. But that's just a very frustrating and quite demoralising place to be. You don't want to go from Essex designing a hospital discharge service into Southwark to design essentially the same service. And I know LOTI has always wanted to tackle this. I think when we were first having conversations with the LOTI team, it wasn't always about technology. It was about how do we really create service change at a city level, which I think, Eddie, is what you're trying to do with this. I think the other kind of context to talk about is the fact that we're working in a very tricky political climate, and so our relationships with central government are really tense. And people's needs are changing. So the cost of living crisis, the economic crisis that we're about to go through, the lack of funding through, hangover from the pandemic, incremental change is just not good enough at the moment. We really need to be thinking quite big and differently about this. And then the last thing I'd probably say, Eddie, is that, which I always find quite difficult to say as somebody that's worked in technology for most of my life, that we can't start with technology, but we also can't afford to ignore it either. So I've seen some really interesting pieces of work that ignore technology and never get anywhere, or actually they start with technology and then never get anywhere. So I think the call to action is that we need to do all of this service change, digital data and technology work as one. And then the last thing I'd say is, I know it's really hard working together. We all have kind of independent borough, manifestos, political things that we're trying to make happen. But this is a city challenge, this is a national challenge, and actually we have to work on this together, and no matter how hard that seems. And when we're kind of challenged internally, I think I really want us to be challenging back to our organisations and be thinking about who we're working with. So I'll leave it there, Eddie, if that's okay.
Thank you very much, Emma. Well put. I like the phrase on, yes, the role of technology. I'll be stealing that with accreditation. But in which case, I'm handing to Genta just to help kick off our Q&A.
Thanks, Eddie. So we'll invite you all to share your questions, thoughts, and comments on what you've heard so far. But we have 3 questions for you, which we're hoping you can help with. The first one is, we've already met, Eddie and I and Emma and other colleagues, we've met with a number of organisations, including boroughs, NHS and others you can see on that list on the left. We'd really welcome your suggestions for any other organisations we're missing, specific colleagues in boroughs. We know we need to involve other organisations which are not currently on this list, like the CQC, Department for Health and Social Care, and other organisations like that. So we'd really like to have your suggestions, particularly for named individuals. We can get involved in this work. So that's question 1. Question 2 is about kind of the themes that we are planning to structure the day around. So based on all our discussions we've had with colleagues, as I mentioned, and also based on some research, we commissioned an organisation to do on new service models around the world. We've come up with better care at home, better care homes, and better social support models as 3 themes for the day. Again, would welcome suggestions for any additional themes. We have space for 1 more. Are these the right ones? Do we need to tweak them, or do we need to radically change those? Would welcome your thoughts on that. And then finally, do you have any other general suggestions or feedback on what you've heard today? We'll invite you to either raise your hand or put your questions in the chat, and we'll take it from there. But for now, I will hand it over, or open it to the virtual floor, as it were, for questions.
Don't be shy. Amanda, I like the suggestion of prevention, reducing future demand. I think there's lots of different elements, I suspect, within those themes, but maybe that does warrant being its own one as well. Sorry, we've got a hand up. Sorry, you can see that, Genta, and I'll follow the chat.
Yeah, I think we've got a hand from Vicky. Thanks, Eddie.
Hi, I'm Vicky Robinson and I work in Northumberland, so it's very, very rural area. You can see the castle behind me. It's very rural, and it's geographically difficult to work in Northumberland because we've got a lot of very rural areas where we have people living, but we have some urban areas. And I'm just wondering if, and so part of the problem that we have is maximising independence and social isolation for people and transport links. So there's a couple of things I'm wondering. So I can see that a lot of what you're doing is concentrated in London, and obviously that's a very different kind of geographical map than what we have where we live. So I'm wondering if there's any links into our area. So are you linking in with us and helping us to explore some of the things that you're doing in London, for instance? And the other thing is about the better social care models. So really keen to think about maximising clients' independence and empowering them, and really to try and stop people coming through the front door if possible, so they don't need to actually come onto our caseload, so they're actually diverted out.
Good points again. Do you want to take those?
Yes. Thanks, Vicky. I think that's really, really helpful feedback on the reducing social isolation. I think really, really good point. This has come up so much over the past 2 years, more specifically, because obviously the COVID exacerbating the needs of people who probably were less mobile than others, and increasing the impact of isolation. We've done a lot of kind of separate projects which I can share via email after the call on that front, but really good thoughts, I think, on the prevention side of things. I think we are keen to focus on that, because obviously if you it just reduces demand in the system and things like that. But can I invite probably others, Emma, Eddie, and others on the call to share their reflections on what Vicky said and other points they'd like to raise?
Just on the London remit, clearly, LOTI's primary community as a membership organisation is London, but we're very aware London is not an island, and we're keen to join this up with more national conversations around. So I hope that even if our primary audience is initially from London, everything we create and sort of stimulate through having these conversations, we will share. We always work in the open, including on this theme, and would love to share it. And I think where we can learn from other areas or be cited on how this issue translates into other parts of the UK, very, very keen to factor that in as well, so that we're not just working in our own bubble. We'll think about that carefully, Vicky, and see how we can make sure we're not creating yet another silo of conversation, because that's very important to avoid. Any other comments or questions? In part, I guess, sitting from a LOTI point of view and having had lots of conversations, we're expecting a sort of wave of yes, but this will never work because, and in part, we're inviting people to take a bit of a leap of faith for the sake of having that chance to think more creatively. Almost interested if you're, for any of you just going, yeah, but what about this major objection? We're keen to think through some of those major blockers in advance so that they don't prevent creative thinking on the day. Any thoughts on that would be welcome, but let's just hear from Emma, who has her hand up.
Yeah, Eddie, I think it's probably a follow-up onto what you were just saying there. I know when we had a conversation about this a couple of weeks ago with some other London boroughs, the main challenge was on those free areas. Well, we don't directly run those services, we commission them out, or they're like, essentially suppliers run care homes, or, what's our role in that? And so I'd be really keen to understand from people in the room if that's where their head is. The overall responsibility has to lie with people in government, I think, as well, in terms of us thinking about outcomes for people and how we commission those services. But yeah, I'd be really keen to understand where people where you'd kind of pitch like the blockers on that. So actually, if you were to speak to someone in the social care service in Hackney, and I don't know if we've got anyone on the call from Hackney, like, I don't know where they would say, are those free areas are things that are on fire for them, or are they other things that are on fire? So someone's put something around like workforce in the chat as well. And I know that workforce is a really consistent issue and challenge for us in terms of recruiting really good people into the borough, not just across adults, but also in children's. And so that kind of like, where are the fires? And they may not be the things that we choose to focus on the day, but I think they're indicators of potentially bigger issues that we might need to kind of, understand a bit more about. So I'd really encourage colleagues to be really vocal about those free areas, give us some challenge on that, tell us if we think like they're the right areas, but also like where are the things that are on fire for you, so that we can really curate the day in the best way possible.
There's been some really good comments in the chat as well about involving population health management, particularly about the workforce as well, and whether we could, whether that could be a theme in itself. Like, that's really good suggestion. But I don't know, Alison, did you want to tell us more about that, or maybe ask the others what they think about that?
Yeah, hi, it was me. Put the comments in the box. Just occurs to me that all those themes have that same issue running through them, and obviously there's potential that will come out within those themes, but it's such a big issue that do we need to address it directly? And starting again a bit, as we said, starting with not starting with technology, but not leaving it out. We obviously need to start with the people at the centre of the services, but also the people that are there involved, and particularly providing that frontline care, support workers, etc. As we know, numbers are diminishing. We've got issues with pay, with motivation, with all sorts of things. Does that warrant in itself its own discussion? I should just say I'm, along with Rachel, a colleague from Bjertzorg. So I'm not in one of the boroughs, so it'd be interesting to think, to perhaps hear from other people in the room to see whether that is something they think warrants, does warrant a space by itself, just to, really get to grips with the workforce, without which any of these models, new models, won't work anyway.
Thank you. Very, very good challenge. I think this will be the fascinating thing as part of the design of an event like this, is just how do you try and cut the conversation into manageable chunks. But you're absolutely right, this permeates all of it. So that plus prevention as two common strands, we'll have a real think about how we can integrate those thoughtfully to make sure those conversations are productive. Anything else that anyone wishes to raise at this stage? Don, please do come in.
Hey, this is awesome. I really love your ambition and the approach you're taking. I think the thing for me goes to Emma's point to some degree around how can this be used to make a bigger market statement, I guess. Like, how can it be used to say, we've got a broken market essentially in this space in the UK and elsewhere. That there's been an awful lot of market consolidation, a lot of control has been taken out of the hands of local authority. When you're a commissioner, a lot of the time you can look at all the data you like, but if you haven't got any choice in the market, then you're going to be commissioning pretty much the same stuff and hoping it's better and cheaper. But I think we're probably at the end of that phase. Like how might we reach out to others, like social investors, like Big Society Capital, Bridges Outcomes, people like that, to possibly become a sort of third leg on the stool of this to help supercharge these ambitions, I guess, because I know they're just as keen to help from the outside and act as the sort of investor save mechanism or the invention mechanism that if and what they're lacking a lot of the time at the moment is sort of an ideas pipeline and an energy to get behind. There's actually shockingly few investable propositions for people like that right now, and I feel like you could play a super crucial role in that through this process.
That's a really great point, and actually you're right, we've been trying to think who might be able to augment the financial resources we can put behind this, but I think queuing up some of those conversations to bring in some of those social investors to be aware of this and to support us to create those investable models sounds very wise if we're serious about scale. And from everything we've heard about the problem, scale is going to be critical to making a dent. Thanks for that. We'll see what we can follow up with on that front. Any final comments or questions? I see one from Jane. So Jane is asking about the expo that we're holding on the Innovation Day. And yes, so what we'll be doing is inviting a certain number of organisations, as Gente said, who we think represent that element of that sort of thinking about radical new models. Again, abundantly with the caveat, we're not saying copy and paste them, but purely to distill what's interesting and different about those models that might help us think more creatively about what we can do in adult social care. There'll be a chance, an hour-long session where all participants can move around, talk to those organisations, really learn from their experience, hopefully make some very useful contacts, but then bring that back into that ideation phase of saying, well, okay, based on what we've made of those, what's the stuff that feels totally implausible for us? Are there nuggets that we can then build into our design to start the conversation about new ways of working that we hope can then snowball into some proposals that can go forward to the LOTI fund? We'll reveal more details of exactly how that expo will work slightly closer to the time. Steve.
Thanks, Eddie. Really useful conversation, and I've got a bit of a bad line, so I might drop off before I make my point. The thing that strikes me, which you may have already touched upon when I wasn't on the call, that we're all tackling the same problem, but individually. So I look after 2 councils. I'm very likely to run 2 identical programs, trying to tackle the same question of how do we build good digital services to start to address some of the demand pressures through the front door. So there's definitely something for me about why can't we come up with the patterns and do that once for the whole sector? You can plug your own services into it, but the actual journey is, we've worked it out, we know how to do it, and we can replicate that rather than every single local authority doing it individually, which is what we do at the minute. So I'd be really interested in talking a bit about that when we on the day, if possible. Thank you.
Absolutely. I think that sounds like that resonates strongly with what Emma was saying, the frustration of having to sort of reinvent the wheel so many different times. That challenge of balancing localism with removing the occasional insanity of having to do things from scratch so many different times. We hope we can really get that. As we said, as Genta said at the start, it's the coalition of the willing we're trying to seek out here. Who is able to join us on that journey? If we can get a critical mass, we hope that can be really, really compelling. But yes, that will certainly be a part of the design of that day. Emma, do you want to respond?
Yeah, Eddie, sorry, I was just going to come in on partly on the point that Dom was making around the market, which I think is a really key point and something we probably need to kind of start with when we're talking about this, because I think quite often when we've worked with consultancies, they'll say things like, oh, social care's broken in this country. And that's really demoralizing for people who are running really good operational services in many parts of the country, actually. You know, we've got people who are working really hard, working their asses off, like, despite the system. But when we talk about the market being broken, you know, it's easier for us to then say, without judgment, you know, this part is failing over here and this part is failing over here, but it's because of this thing called the market. And I think in government, especially in local government, we often don't talk about the markets enough, actually. But on that point, I was going to say, are we inviting colleagues from central government, whether it's, you know, Department of Health and Social Care, to the day in November as well? And then crucially, I think a key I don't even know like where they are in the system, but like regulators and the kind of role that regulators play, which I've often experienced as quite a blocking role, really, because they don't necessarily understand the way that we're trying to approach from a kind of change and innovation perspective. I think having some, you know, whether it's CQC or whoever, some regulators would also be quite helpful to be in the room as well, especially with like new legislation coming up with CQC as well.
It's a great point. And I think, in fact, Genta, were those 2 organisations we were going to ask for advice on?
Yes, please. So if anyone has any suggestions, I think that we'd welcome those. Any contacts you may have. I'll put my email in the chat if you wanted to email me directly.
But now, though, keen to finish on time, make good use of your time. Thank you for coming today. Tomorrow we'll send out an email to everyone who's come today with the details of how to sign up. We'll be warmly encouraging you to share that with colleagues as well. Be interesting to see what demand we get from different parts of the sector. So if you'd like to register your interest, we will be sharing that. And as Genta says, you'll see her email at the bottom there. Please do get in touch. It's also in the chat. Please do follow up if you've got thoughts, questions, concerns, or other great contacts that you feel that we could involve. Before we wrap up, Chloe, you've raised your hand.
Sorry, very quick question. Is there a limit to how many people can attend from each borough or area?
It's a good question. I think what we'll do, so when we release that Eventbrite link, which you'll get in your inbox tomorrow, it will be sort of register your interest, and I think we'll try and say yes to as many people as possible. If we get flooded by sort of 10 people from one organisation, if that sets us over the maximum capacity, we might have to try and go back and say, sorry, could you select the 4 or 5 instead? But we'll try and make it as open for as many people who feel they can add something to that conversation. So please, in the first instance, register your interest, and then we'll confirm places as soon as we possibly can. That I'll just check in with my colleague Genta. Anything else we should say?
No, just the very last point that alongside this work, we're also working with TPX Impact to kind of map the systemic challenges on adult social care. We've got 3 workshops planned in October. So one, well, in October, I think if you'd like to get involved into or contribute to that conversation, again, please email me and I'll forward you the diary invites.
Wonderful. For now, thank you very much, everyone, for your interest. We very much hope to see a large number of you on the 21st of November. Look out for those details in your inbox tomorrow. Thank you very much for now. Have very nice afternoons.